Today we are talking about cording. I'm going to explain what it is and what I have been doing about it since my double mastectomy. As always, please subscribe to my channel to always be notified when there's new videos, and come follow me on Instagram, Jessica Valant Pilates, for more daily stories and tips. Today we are going to talk about cording. So for a little context, many of you may know that 4 months ago I had a double mastectomy with reconstruction due to a breast cancer diagnosis. I did have one lymph node removed. It was the sentinel node biopsy. We're going to talk about that. And since then I've experienced some cording. I'm also a physical therapist, so I've been a PT for almost 25 years, and in that time, I had never heard of cording. So I am coming to you today with what I have learned in the past 4 months, both from a physical therapy side, but also simply as a patient. So I'm going to talk to you about what I've learned and what I'm doing for my own cording. I also highly recommend that you find a rehab professional who specializes in breast cancer close to you to see in person. I've been seeing a physical therapist here in person for the past 3 months. It has been so valuable to me to learn, to have someone on my team, to have an advocate, and also someone just to talk me through the process and help manually with the cording and some of the pain that I've been having. So again, you would want to either talk to your surgeon or simply find someone close who specializes in breast cancer to help. And if you don't have the ability to see someone in person, I will give you some things today that you can do yourself at home. So first, we're going to talk about what cording is. So typically when you have a mastectomy, you're going to have what's called a sentinel node biopsy. That means they're going to remove one lymph node from the affected side to check if the cancer cells have spread. And sometimes they'll remove more than one. I'll just tell you my story. I had one removed, so it's called a sentinel node biopsy. I didn't think twice about it. I understand lymphedema. I've actually worked with many patients with it. But knowing that they were just taking one lymph node, I really thought nothing about having a lymph issue after surgery. That was wrong thinking. So even removing one lymph node can cause some issues with your lymph system, which ultimately is what cording is. So let's talk about that so you can understand why it's happening. So your lymph system is a system of small vessels throughout your entire body. It's like a network. You can think of it almost like a really tight glove that is on your body, this network of a ton of vessels and nodes, and it is meant to move lymph, that's fluid, throughout your body. It helps to kind of detox in some ways. We're going to move those things through our body and help detox them out of our body. It moves fluid constantly, and it's a really important system. And you might be aware of it for things like when you get sick or when you've gotten a cold and you get swollen lymph nodes. That's a part of your lymph system. So you have lymph nodes in many places throughout your body. Common places are here in your neck, here, kind of right around your collarbone, in your armpit, and in your groin, and you have them in other places as well, but those are the most common places. So imagine your lymph system basically like a highway. That's how I picture it. So like this 8-lane highway, constantly moving, 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 moving. That's the fluid that's moving throughout your whole body in those vessels. Then your lymph nodes, kind of those places that we have lymph nodes, I think of those as kind of traffic lights or almost a station that's usually just going. You just move through the station, you can keep going, there's not a problem. Sometimes when you get sick, because those lymph nodes are the places where kind of those toxins or the things we need to push out of our body are dumped. So sometimes when we get sick, it gets a little sluggish in that area, which will cause it to swell up, because we have a lot of germs and things that we're trying to get rid of when we're sick. That can happen, then we get healthy again, and it keeps moving. So what happens when we even remove one lymph node is it's like taking that really fast 8-lane highway and you are causing a red light in one lane, or like a blockage in one lane. All of a sudden, that lane can't move. And so what needs to happen is everything has to kind of be rerouted to the other lanes. It can slow it down. So even just one lymph node removed can cause this issue with your lymph system in that area being able to work efficiently. And that's what can happen after a lymph node biopsy. And that's one being removed. And you can imagine if you have gone through breast cancer treatment and it had spread to your lymph nodes, if you have had many removed, this is going to be even more of something that you want to manage over time. This might be a lifelong management where you want to think about how you can best support your lymph system so that it can do its job efficiently. So again, if you have many removed, you're going to be aware of things such as lymphedema and swelling. You'll want to be aware of things such as even getting scratches or cuts on the arm or burns on your arm, things like that. Typically, for just the one node being removed, we're just going to have some awareness of making sure that we support our lymph system on that side and in that arm. And this is where cording comes in. Okay, so finally to the meat of what we're talking about today. I just think having that context and understanding can help a lot of why this is happening. So cording comes in when basically those lymph vessels get really tight, and we don't necessarily know why. That's been interesting to me. Some people think it's actually a nerve issue. Some people say, no, it's a lymph issue. I believe it is a lymph issue that can then affect some other tissues around it. But basically, it gets very, very tight and feels like a cord. To me, it felt like guitar strings. I felt 5 really tight ones right here in my armpit when it first started happening. Very, very tight and a little bit sore. And I first noticed it about 3 weeks after my surgery. Then it started to get worse actually, and it traveled down so that I got pain in my wrist and in my hand down in here. And my physical therapist has helped a lot for that. So what we've done is we've done a lot of manual work, meaning massage, and I'm gonna show you the massage I do every single day at home on my own. I also wear a compression sleeve on days that I'm active, and that's helped a lot. You can just buy them online. I'll put the link below to the one that I like and use. And basically it just goes from right here all the way up to my armpit. And like I said, I wear it when I'm typing during the day, when I'm filming, when I'm walking, when I'm working out. Anytime that I'm really active and busy. You don't need to wear it to sleep, but just wear it when you're busy, because anything you do to stress that lymph system can make your cording worse. So you want to stay active, but you also need to think of how to manage and help it. So let me show you the massage that I do daily to help myself. Okay, so I'm gonna show you kind of the shortened version. It takes me about 10 minutes at home when I do this, and I use a body oil. So I use vitamin E oil on my scars, but that doesn't work for what I'm gonna show you here. It's just way too thick. And I found something like just a body lotion doesn't work because it just kind of absorbs right into your skin. I like a light body oil. I'll put the link to the one I really like below as well, but any kind of light body oil can work well. So what you wanna think about is, just like if you're clearing traffic, you need to get rid of that first car in line first, right? If you're the 10th car in line, you can't just go until this one is moved. It's the same thing here. You actually have to start with the lymph nodes themselves. Then you're gonna massage the next area down, then the next, then the next. You have to clear it up here first to then help the fluid move out. That's one of the keys, okay? So what I like to do is I start right up in here, kind of on my chest and my armpit, and I do some circles. And I would do about 10 in one direction and then 10 in the other. And again, at home, this takes me 10 minutes. Every single morning I do it, and some nights as well. I'll just show you the shortened version here. Then I go right into my armpit and I do 10 circles, nice and slow, you can see, and then 10 circles the other direction. This isn't the deepest massage of your life, all right? You're just kind of moving skin and maybe a little bit deeper, like it's about 40 to 50% pressure, all right? You're not doing a huge deep massage. And then I like to even go up to my neck here, kind of right under my ear, and I do 10. So that's how I start. I'm kind of priming the area. And then another thing you can add that really helps is 10 deep breaths. So you can just rest your arms after those circles in those 3 areas, 10 deep breaths, because even diaphragmatic breathing can help prep your lymph system and help it move more efficiently. So I like to start with all that. And then I move into my upper arm. And I'll spend probably about 2 to 3 minutes here. And again, it's kind of these nice circular motions, and I'm moving up towards the armpit. I'm not pushing down, all right? My pressure is up. So if I'm doing a circle, I'm doing a pressure up, and I'm doing really just not much at all going down. I'm just moving my arm down. So really pushing it up. And then I'll move down to right here in my inner elbow. And I, again, 10 circles one way, and then 10 circles the other way, and take your time, okay? I have found this to be extremely meditative, actually. It's very much self-care. It not only helps my arm, which it does tremendously, but it just helps me process a little bit. It helps me take a breath. It helps my emotions come back into check. It helps me come back to the present moment during a time that feels really scary and really unknown and unsure. I do this in front of my red light therapy actually every morning, and it has helped me tremendously. So then after that inner elbow, I come down and do the same thing up my forearm. Kind of those general circles. I'm pressing up and being light when I go down. And I'll spend about 2 minutes here. And then for me, because the cording actually, when it hurts the worst now, like I said, I'm 4 months out, it has gotten so much better. I do not have the cords in my armpit at all anymore. Okay, so at this point, those are actually gone. I have full range of motion in my arm, but I get pain down in my wrist and my hand. That's where it gets angry with me. And so I spend 2 to 3 minutes down here. But again, if you don't have that as much, you might spend that time up high. So I think 10 minutes is great and plenty. You can make this 5. Don't feel like it has to be 10. There are times I will sit and do 2 minutes worth. As long as you do that procedure, the circles up here first, then here, then your forearm last, you're doing something good for yourself. Okay, so that's the self-massage piece. Then what I do is these waves. My physical therapist actually taught me this. So arm out in front of me, and I don't know if you can see my hand, hopefully in the screen. I'm just waving it nice and slow, and then I keep it pulled back as I lower my arm down. So my elbow's totally straight. I'm doing it slow. You don't want to hold a weight. What this is doing is, again, helping like to move that fluid. So you do 3 in front of you like this, then 3 at an angle out to the side. And sometimes, like I said, if I'm in the shower, I'll only do these if I need to, but just do them 2 to 3 times a day. Because if you do have severe cording, just know the more exercise and activity you do, you can make it worse. You want to think about how to manage this. And then over time, I've been told that it does go away. All right, so 3 in front, 3 to the side, and then I'll bring my hands behind my head and I open and close. Open my elbows and close, and I do that 5 times. And that's the procedure that I follow. I know I gave you a lot of information there. I personally searched and searched and searched for information on cording and didn't find very much. So the few things I found, I was so grateful to have it, and I wanted to bring it all together and share it all with you here. I hope that helps to guide you, or at least lets you know that there is hope. It can get better. There are things you can do at home. Bring these questions to your own physical therapist, and definitely continue to put one foot in front of the other. Thanks for being here, and I'll talk to you soon.